Hey guys, it's Cassie with your Nurse Call Responder 5 update of the day. This is for my OR, PACU, and ASC teams. This is the first screen that you see when you touch the staff terminal, which is the touch screen in each of the rooms. Each of these buttons does a different thing. Some of them alert phones, some of them call people, and some of them turn on lights. The lullaby is for us to play after a mom has had a baby, so this can be done from the C-section area or the labor and delivery area. The needs meds actually notifies your charge nurse to assist with medication administration, since in the recovery phase, all of these patients are one-to-one. Case complete notifies the EVS team and our partners that a case is complete and the OR needs to be cleaned. The anesthesia alert goes to our anesthesiology partners. Yellow segments will flash outside of the room, and this will alert to the anesthesiologist of the patient that they are ready to be signed out. The timer actually goes to another screen, and you have the option of setting a 15-minute, 30-minute, 45-minute, or 60-minute timer. When you set this, it will come to your phone if you're the person assigned to this room. Room clean is for EVS to notify us that this room is now ready. It actually puts on a solid green light outside of the room, and as you can see here, it's been pressed because there's a little red box around it. This also notifies the charge nurse that this room is ready. EVS will notify the EVS person assigned to this floor. So in this case, I'm on the second floor, but the same holds true through the entire building. If I press EVS, it will alert the EVS person assigned to this floor, and it will blink, flashing orange and yellow outside of the room until the EVS personnel comes here and does what they're supposed to do. So if I press this, you'll see that it turns red because it means that I have activated that button. When my job was done, I would press it again, the red box goes away, and the alerts and lights stop. Clean screen actually times this out for 30 seconds so I can clean the screen by swiping it with my Cavi wipes or my bleach without setting off any alarms. I'll show you that at the end. If I press medical emergency, it goes to all of the emergency buttons that we might have in the building. Neonatal emergency blinks pink outside of the room and calls all of the NICU emergency personnel you might need if a baby needs help. Missing child actually calls security, so you would talk to them through the speaker here. This calls dispatch so they can notify people overhead and deploy security guards if your patient really is missing. Each of these things has lights flashing outside of the room as well, so neo emergency flashes pink and missing child flashes orange. Obstetric emergency would call the women's team, so I would use this if a baby delivered somewhere where I didn't want them to, or a mom really needed help from our OBGYN team. This notifies everybody on that OBGYN team that responds to emergencies. All emergencies will also notify the partners in your area so you can get help when you wait for the neo-emergency team, obstetric emergency team, or others to respond. If I were to press RT, then I would get the respiratory therapist assigned to my area. They would be notified through a text to their ASCOM phone telling them the room number that I am in. If I hit rapid response, I will have red blinking lights outside of the room, an alarm will sound, and it will go to the rapid response team. Please remember that they have 10 minutes to respond to you, so if you need them now, hit medical emergency. Medical emergency is essentially our code blue. It calls everybody on your floor that can help, so that would be everybody on duty, RNs, MAs, RTs, physicians, and mid-levels alike. It blinks blue outside of the room and sets off an alarm. It also calls the STAT team and the ED charge nurse. The delivery team is for when a baby is coming imminently and we need the delivery nurse to come down and help us. And finally, staff assist is what you hit when you need some hands. So this gets you people in your area, RNs, MAs, and RTs, not providers. If you need a provider for an emergency, hit medical emergency. If you just need help, hit staff assist. Remember, the gray button back home brings you home, and when I hit clean screen, it tells me you have 30 seconds. So I'm going to press this, and now I have 30 seconds to clean this screen without setting off any alarms.